Located on a 58-acre campus in downtown Fresno, Community Regional Medical Center is Central California's leader in diagnostic and interventional heart procedures. The only academic regional medical center from Los Angeles to Sacramento, Community Regional is armed with leading-edge facilities and unequaled specialists, all performing more cardiac procedures than any other institution between Stockton and Los Angeles, and all committed to giving its patients the highest level of care.
I think that if you look back in 3 years, the Community Regional has actually sort of surprised out as a leading program in the Valley, and how the administration and the whole team in cardiothoracic surgery is working is to make it a state-of-the-art program. And we're pretty close right now. We are producing the results and the number of cases more than anybody else in the Valley, and the target is hopefully in next year or so you will see that we'll be #1 program in the state. The beauty of this regional medical center, Community Regional Medical Center, is that everybody is doing their own things and they are specializing in. And my main interest is congestive heart failure and off-pump cardiac surgery. So everybody brings to the table something special. We had another partner, Dr. Sheldon Cohen, who died in 2003. He actually started this program. So the program has developed since 1985. We continue to progress and set the higher and higher standard for ourselves.
91-year-old Helen Brown remembers the feeling of first realizing she was having a heart attack.
I would get out of breath, and one evening I was having dinner with my son and daughter-in-law, and I was eating my salad and I just passed out. And they took me to the hospital and they found a blockage, and the doctor recommended surgery.
Helen was taken to Community Regional Medical Center in Fresno, California, where Dr. Pervez Chaudhry performed an emergency cardiac procedure. This off-pump surgery allows a surgeon to operate on the heart while blood continuously circulates during the operation, reducing the risks and complications commonly associated with temporarily stopping the heart during surgery.
Off-pump surgery is that we do not support the patient with a heart-lung machine, and that's what we're doing. That is the state of the art at this point. When I came into this town, we were doing about 6 to 7% off-pump surgery. Just to give you sort of comparison, nationwide, it's done about 20%. Right now at Community Regional Medical Center, we are doing about 90%. The patient's own heart continues to support, just like if you were getting this operation on your liver or stomach or getting hernia repair. Your own heart is supporting. There is no other extra machine or anything, heart-lung machine supporting your body. And that's how the surgery is done. The heart is manipulated, put in different positions, and operation is done. It's rare that after a month, any one of my patients is not ready to go and do whatever they want to do. After about a month, 6 weeks, I don't have any restrictions on it. And that is the benefit of it.
Other advantages of this procedure include better survival rates, especially among high-risk patients, less time in the hospital, quicker recoveries, less chance of complications to the rhythm of the heart and other organs like the kidney or liver, and reduced risk of stroke and memory complications.
It used to be that, okay, good target, good anesthesiologist, good heart, this is the patient that's candidate. This day and age, and people who are trained, it's rare that I ever exclude any patient from this. It's, to me, anybody who has a coronary artery disease is a candidate for off-pump surgery.
I would recommend Community Regional Medical Center because they took very good care of me. Dr. Chaudhry performed my surgery a couple months ago, and now I'm home and I do my own yard work and, I tend to my flowers. And I feel great. I can walk without getting out of breath. I go to lunch with my lady friends, and I go to church, and I'm active in my church, and I go to movies, and I play bridge. I just love life.
For somebody to walk into a cardiologist's office and say, you know what, you're going to need open heart surgery. Its psychological effect is so huge on a patient. And then sitting and telling them that by the end of the day, you're going to be sitting up. Next day, you're going to be up and walking. And when people do that, it's a great feeling to just look at them And that comfort they have, it's like it's over. After discharge, I see them after 1 week. And routinely after 1 week, I'll hear, can I start driving? I'm fine. So after 1 week, being in the condition that I can drive around and I can go, and they feel good about it.
Our cardiac team here does a full range of adult cardiothoracic procedures. We've been able to move ahead with a lot of the leading surgeries, and this includes a full range of cardiothoracic surgery, for example, off-pump beating heart coronary bypass surgery, extensive mitral valve repair experience, as well as experience with video-assisted thoracic surgical techniques, and another new emerging technology includes thoracic aortic endovascular repair.
It's a level 1 trauma center, so we just made it level 1 cardiac care center. Just never say no. Anybody calls, we don't say that we don't have a bed, we don't have a surgeon available, we don't have this thing or that, or wait, we'll call you back. If somebody calls that they have a patient who needs a cardiac care, we say put him in an ambulance, put him in the chopper, we'll accept it. So continue to progress in that direction. We have developed a state-of-the-art institute within an institute. Every single member of the team is highly trained and dedicated to the program. It's a dedicated team, day and night, thinking about the program and thinking about the patient.
Certainly our vision is that we want to continue to be leaders in all aspects of cardiothoracic surgery. As our field evolves, we're at the forefront of the technology. Also, another mission that we have for the future of our medical center is we want to expand our identity as a referral center for patients up and down the Central Valley of California.
Learn more about Community Regional Medical Center today. World-class care in the heart of Fresno. For more information about its commitment to cardiac care, go to communitymedical.org or call the number on your screen.